Imagine you have lost your job and with it your medical insurance. You have few resources and no savings. Let's imagine also that you may have 3 children to care for and bills that still need to be paid. Now imagine you also have diabetes and that you take insulin and you have no money to purchase supplies, medicines, or the insulin itself. You've applied for financial assistance and Medicaid, but you've not heard back when or if you've been approved. Where do you turn to for basic medical services? Imagine different but similar situations, such as if you were homeless or displaced or recently released from jail and unable to get a job. Or let's say you had a drug addiction and you were in the process of recovering. During this transition period, you cannot afford to incur large medical bills for yourself or your family. Where would you turn? Is there a safety net for these kind of situations? And is there a place to turn to get medical care without incurring large costs? I would like to welcome you here today. The topic of our podcast today is the medical care for the homeless and the uninsured. This podcast is brought to you by the Ogden Surgical-Medical Society, and I'll be your host. My name is Dr. Mark Johnson, and I am a family medicine physician working in Layton, Utah, and I currently serve on the board for the Ogden Surgical-Medical Society. I would like to introduce you to our guests today, Ruth Brockman and Dr. Chelsea Slade. I'll start with Dr. Ruth Brockman. She received her RN at Medical Hat College in Alberta, Canada, and then a BSN at the University of Utah and an MBA at the University of Phoenix. She has extensive work experience in the ER in Alberta as well as McCady Hospital in Ogden. She has worked in intermediate and critical care and has been the director of McCady Hospital's critical care, heart oncology, and medical care units, and was McCady operations officer until her retirement in 2011. She has served on several nonprofit boards, including the McCady Foundation, as well as the Seeger Memorial Clinic at the Ogden Rescue Mission, where she is currently the executive director and manages this clinic, which serves the homeless and uninsured. Our second guest is Dr. Chelsea Slade, who received her BS in biology at Brigham Young University, her MD from George Washington University, and then completed her family medicine residency at McCady Hospital in Ogden, Utah. She is currently a hospitalist at McCady Hospital and works as an urgent care physician for Intermountain Healthcare. She is also Chief Administrative Officer at the Seeger Memorial Clinic at the Ogden Rescue Mission. Welcome. It is a pleasure to have you both with us today to discuss this important topic of medical care for the homeless and the uninsured. So Ruth, let me start with you. Tell us just a little bit about the Seeger Memorial Clinic, what it is and when it was started.
All right. So the Seeger Memorial Clinic is a free medical and dental clinic and provides services to the homeless, working poor, uninsured, and underinsured. It was started in September of 1988 by Dr. Floyd Seeger, a local internist, and he was actually going to a Ogden Surgical meeting at Union Station when he saw a man fall in the street. He stopped, got over to help the gentleman, and realized that he did not have any medical care. At that point, he decided to approach the Ogden Rescue Mission and the 2 local hospitals about setting up a clinic for those in need.
Is Floyd Seeger still with us today?
He's not. He and his wife started the clinic, and he's a very compassionate man. He did a lot of interesting things. He served in World War II and the Korean War in a MASH unit there. He helped bring injured people into the hospital. He was a jazz musician and a very good teacher. He was a professor of medicine at the University of Utah, and he was named Doctor of the Year in 1999. He received an award from President Herbert Walker Bush as one of the points of light for starting the homeless clinic, the Seeger Clinic. He passed away in 1997.
So who are the patients generally who come to the clinic there, the Seeger Memorial Clinic? Are they homeless population, or are there other populations that come?
So some are homeless and some aren't. Many of the patients are actually staying in the shelter at the mission, and others are staying there for drug and alcohol treatment, which we consider to be homeless. Some are living in their cars or under the viaduct, and others are living in low cost housing, either with or without insurance. We pretty much serve all comers.
Do you find that a lot of these patients come to the clinic for just a period of time, sort of as a safety net clinic, or are there some that are there long term?
Some are long term. You know, we've had some, especially with chronic medical conditions, that have been coming for many years. Others are passing through the area and we only see them once or maybe twice.
What sort of services do you provide at the clinic?
So all the patients are seen by a provider and evaluated and treated if appropriate and given medications if needed. We see general medical services, medical patients with chronic and acute needs. We see diabetes patients, mental health, podiatry, ophthalmology, including prescription glasses, and dental, including partial dentures. It's hard for a patient to get a job if they can't see or if they don't have any front teeth.
And you mentioned about mental health services. Um, do you see a higher percentage of those who come to the clinic who have mental health disorders or diagnoses?
We do. We do see a lot of mental health illness. We have two providers that see patients for mental health, and then our other providers help provide refills for their prescriptions. They do an online assessment of their mental health, and that's shared with the two providers that do that clinic. We also see patients from the jail. When they leave jail, they get a 7-day supply of medications, and then they come to us for refills. And that helps a lot with recidivism in terms of keeping them in the community.
And then you said you see diabetics as well, and the dental clinic. I imagine so. With the dental clinic, there's not a lot of clinics out there for dental care. Is this one of the
No,
only ones you know of?
no, I'm not aware of others. There is one at the Hope. There is dental services at the Hope Clinic at the Lantern House, but it's a totally different dental practice than a usual dental practice because a lot of the patients that come in with really poor dental health. And many times it requires an extraction rather than a restoration. We do some restoration and some crowns, but a lot of times the patients are in a lot of pain and the tooth is infected, and the best thing to do is to get it out.
And then you had mentioned also about an eye clinic.
Yes.
Is that is that for fitting glasses or doing full eye exams, or how extensive is that?
Yeah, we have an ophthalmologist that does a full eye exam, especially helpful for those patients with diabetes that may have retinopathy. But we also do refractions, and then we order glasses for them at low cost and give them glasses.
So I understand you have there you see all comers as far as general medical needs,
Right.
as well as the specialty clinics, which you said included eye clinic and mental health services and diabetes and dental. And you said also, was there a podiatry clinic as well there?
Yes, there is a podiatry clinic, and that's something that would be good to expand because a lot of these folks do have issues with their feet.
So I imagine when you see patients, every now and then I would assume you're going to run into a patient who will need some sort of referral or higher level of care that you can't provide there at the free clinic. What do you do in those situations when someone needs a referral?
So, if they need a diagnostic test, we can give them diagnostic vouchers to go to a local hospital, McCady Hospital. Or if they need lab work, we can draw it there and take it to the hospital to be run. If they need subspecialty care, we can refer them to the Midtown Clinic. The Health Access team will help them get into subspecialty care. Or we've been able to find some providers in the community that are willing to take these patients at a pro bono um, experience.
And the providers that you have at the clinic, volunteers, do you have a hard time finding volunteers, or are you able to find enough people willing to give their time for the clinic?
It's amazing. Up until the virus, up until the coronavirus, COVID-19, I was able to find volunteers with no problem. Actually, they would find me. A lot of times, retired nurses and physicians will want to volunteer. I get pre-med students that are interested in volunteering. I usually don't have a problem at all finding volunteers.
Well, thank you, Ruth. I'm going to ask Dr. Chelsea Slade a few questions here. Um, Tell us how you fund this clinic. I imagine it takes quite a bit of resources in order to put this all together. How do you fund it?
Well, we're pretty cost effective. Each cost of our visit is about $17, and that includes seeing a provider, getting all the diagnostic testing that we do, including labs, immunizations, medications that we give to our patients, dental supplies, everything. The average cost per visit is only $17, which is pretty awesome. And all of our care is provided 100% free of charge to our patients. There's no bill to the patient. We don't bill insurance companies at all. We just provide free care. So our funding, we're not funded by government at all. We don't get any direct government funding. All of our funding comes from private donors, individuals in the community who want to give back. We have some kind of larger philanthropists in the community who are involved, as well as people who just send, $20 or $50 once a year. Every little bit helps. And then we have a couple of charitable organizations and foundations that have been pretty regular funders for us, and we're always looking for new grants. But we try to keep really good stewardship of those funds. We're entirely run by volunteers. We have 130 volunteers, and then there's one paid part-time employee who works about 6 hours a week, and she kind of is the glue that keeps things together as far as running the clinic on a day-to-day basis. But we try to keep our operating costs as low as we can.
And are there other resources in the Ogden area, as far as other clinics like this that provide services or other services for the homeless besides the Seeger Clinic?
There are a couple of kind of like-minded organizations. So we are with the Seeger Memorial Clinic, and Ruth explained what we do in detail. There's also another homeless shelter called the Lantern House, and they have a clinic called the Hope Clinic that's available to residents of the Lantern House and other individuals. They have a little bit stricter criteria on who they can see as patients, but they provide similar services to us. There is a county organization called Weber Human Services, who recently started a kind of primary care clinic. It began as a mental health clinic and then has branched into primary care. So that's available to more marginalized and kind of lower income members of the community. And then there's the Midtown Community Health Center, which is a standard government funded community health center, which sees patients on a sliding scale fee basis and also accepts most insurances. So there are definitely different resources and options available, but we each cater to a little bit different population.
And Ruth, let me ask you just a little bit about the current situation. I understand the clinic had to recently stop seeing patients in person because of the COVID-19 pandemic. Is that correct?
Yes, that is correct. Again, a lot of our volunteers are retirees, and some of the ones that aren't are taking care of elderly parents. And so they're a high risk population. And I found that I could not staff enough volunteers to keep the clinic open. So we moved our medications and charts off site. and started telehealth. And that's how we've been able to give our existing patients refills.
And how do you think the homeless population or even the uninsured population has fared during the COVID-19 outbreak with having less and less services available for them?
Yeah, I think it has been challenging for them. They are starting to call us more, leave messages, and request refills. Or if they have a prescription from another provider or emergency room, we will refill that as well. So they're starting to pick up on that, but I think it has been more difficult without the services that we provide.
And if I can jump in on that, Mark, I mean, the homeless population, this is kind of a perfect storm. They're often in, cramped, crowded living conditions. They don't really have access to running water and soap to wash their hands. Carrying a bottle of hand sanitizer around all day might not be an option for them. They don't have control over the food they eat or know where they're going to sleep. And they often have a lot of comorbid conditions that put them at higher risk. There's a fair number of elderly homeless. A lot have respiratory problems or are current smokers. And so this population is in particularly high risk for an outbreak like COVID-19.
Has that been seen in either the Ogden area or other areas in Utah where there have been outbreaks of COVID-19 in homeless shelters or even clinics like yours?
Yes, it has been seen in Salt Lake. They had a high number of patients that tested positive for COVID-19. In our shelter, in the rescue mission, about 7 patients have been tested, is all, and they have all been negative. They have greatly restricted the traffic in and out of the shelter, and they hand out bag lunches outside. When we deliver medicine to them, we hand it out in the parking lot so the volunteers are not inside in closer quarters with the patients and the people staying there.
And I just read an article in JAMA. It was published in April of this year. There was a homeless shelter in Boston. It has about 400 residents, and people started getting symptomatic, and they tested and had about 15 or 16 positive cases. And they decided to test the rest of the population at the shelter, so about 400 people. And they had a positive coronavirus test rate of about 36%. So most of those patients, about 90% of the patients who tested positive had no symptoms at all. But just by living in that kind of cramped environment with all the concerns we talked about earlier, the infection rate in that community was really high. And I think that would easily be something we could see once coronavirus shows up in a homeless shelter. It will spread fairly quickly. So most of the shelters in the area are taking steps to screen people for symptoms before they come in and separate anyone who might be symptomatic from everyone else. And then a lot of local health departments have started setting up hotels or other facilities to use as kind of quarantine locations for patients who don't have an option to self-quarantine at home, like those who are homeless or can't make that work otherwise.
Yeah. And I imagine also the patient population you see is probably in the higher risk category for complications of COVID-19 if they did contract the virus. If your patient population, has a lot of diabetics and lung disease and mental health disorders as well.
Yep.
So, Dr. Slade, besides COVID-19, what are some other health conditions that the homeless are vulnerable to?
There's a lot. So the American Academy of Family Physicians has some really excellent resources on this. And most of the information I'll talk about comes from resources published by the AAFP. But so the average lifespan for someone who's homeless is only 42 to 52 years of age. And there's a lot of reasons for that. There's high levels of substance abuse, uncontrolled medical conditions like diabetes and high cholesterol, high blood pressure. There's a lot of psychological and physiological stress that comes from living outdoors in the elements, not knowing where your next meal is coming from. There are pretty high rates of mental illness. There's a lot of trouble with medication compliance. There's inability to control your diet and other things. You kind of just have to eat the food that you have available. And so all of this takes your traditional risk factors for cardiovascular and other diseases and just amplifies it. And that's not even to talk about, the illness rates that come from living in close conditions, which we see with coronavirus, but also things, higher rates of influenza, overcrowding, unsanitary conditions. And there's also problems with substance abuse, alcoholism, and tobacco use and other drug use, IV drug use. And then you get into problems with sexual abuse, domestic violence, physical, emotional trauma. I mean, most medical conditions, the homeless are at higher risk at for a variety of reasons.
Yeah. How about vaccinations? Are you able to, speaking of preventative medicine, are you able to provide any vaccines for people at your clinic?
Yeah, we're fortunate to be able to do that. So the homeless population in general is at higher risk of a lot of vaccine preventable diseases. So things like pneumococcal pneumonia or influenza, they're at higher risk of due to living in close quarters with others, as well as higher rates of tobacco use. They can also be at higher risk for tetanus because of injuries that they incur. They can be at higher risk for viral hepatitis due to IV drug use. And so we try to focus on immunizing our patients at Seeger Clinic against all of those. We do influenza shots, pneumococcal pneumonia shots, hepatitis A and B, and tetanus shots. Some of those medications, vaccinations, we're able to provide in the clinic. And when we don't have access to them, we have a partnership with our local health department where we can give the patients a voucher and they can go receive the vaccine at the health department. So that is definitely a focus of ours that we have.
How about medication? What sort of medication do you have available to give to patients?
Again, we're really fortunate at the clinic. We are able to keep a storeroom of medications to provide to our patients. We mostly focus on blood pressure medications, mental health medications. We also have insulin and other diabetes medication, as well as insulin supplies. But then we have things like antibiotics and ibuprofen and Tylenol and over-the-counter medications that our patients aren't able to afford. So we're able to stock a good amount of medications and are able to provide most of our patients with most of the medications that they need for free. We don't do any controlled substances or gabapentin. We've decided, the risks and implications of having medications like that are definitely not worth it for us. And our patients know and respect that. And we don't get requests for things like that very often, which is good.
And you mentioned that, so the Seeger Clinic has been located at the Ogden Rescue Mission, and that is a treatment facility for drug and alcohol addiction. Is that correct?
Yeah, the Rescue Mission is a cool program where it's a homeless shelter. It's available to anyone who needs a place to sleep, but it's also a residential treatment facility. They follow a 12-step program, kind of a faith-based rehabilitation program for drug and alcohol abuse. And they have people who live there for a year or longer going through this program and completing it to try to put their addictions behind them.
So you have, coming to the clinic, you have those who are at the Rescue Mission who are in the program. You also have homeless population, and then those who were uninsured or just currently don't have resources. Is that correct?
Yeah, we see a wide variety, and we'll have influxes at different times. When we had the government shutdown last year, we had more people who all of a sudden had never had to access a clinic like ours before, and all of a sudden couldn't pay for their medical care. And so it was nice to be able to get those patients and families through by giving them a month or two of their medicines that they needed, and then they were able to get back on their feet. So
Yeah, some of our patients do get on Medicaid or a bare bones insurance, but then have trouble buying medication because they don't have any money left. And so we help them with that.
So Ruth, do you have, in addition to doctors and nurses and pharmacists and medical providers, do you have social workers or anybody that's there to kind of help navigate the system and help people get back on their feet and move on to other options?
No, that's an area that we certainly could use. We all try and help people. And, in terms of navigation, We have a coordinator for the diagnostic testing, for medication assistance, but it would be nice to have a care manager for the clinic or a social worker.
I think where that is particularly useful especially for those physicians practicing primary care, if you're seeing, a fair number of homeless patients in your clinic, often these patients are pretty transient, can be hard to get a hold of, and having a case manager involved who can try to recheck the contact information with that patient at every visit and kind of check in on their social needs, make sure that they have a way to get to the clinic with reliable transportation. That resource is enormously helpful in just providing patients with that continuity of care. I've also found it's useful if we can provide patients with kind of a wallet size list of their medical problems, medical history, allergies, things like that, so they can keep it in their wallet. If someone's moving from state to state or city to city, it can be helpful just to have, a list available for whoever's going to be taking care of that patient in the future.
Is the Seeger Clinic pretty unique, or do you find that most communities, like most big cities, have similar sort of nonprofit clinics like this?
So I think Seeger Clinic was one of the first in the state to offer this kind of care. There are other free clinics, and some of them have, more regulations than others. We pretty much see all comers, and a lot of the others might have some restrictions on who they see. They may not see insured patients that need medication assistance like we do. But there are several others now in the state that can help people.
Do you mostly see adults, or do you also see children or teenagers, or just all different ages, or are you restricted to ages?
Yeah, it's mainly adults, and we see very few children because of the CHIP program, but we see maybe a handful a year is all.
Yeah. So the CHIP program is let's see, is that a state or a federal program?
It's state, I believe.
And so the children are usually covered through that program.
Yeah, if we refer them to Midtown, they'll help them and make sure that they're taken care of.
Yeah, I assume the same for pregnant women. They are covered usually with state programs.
Yes,
Yeah.
that's correct.
So the majority of people end up being adults, but you'll see kids or teenagers if they come.
One of the fun things that we have is, because our physicians have many different specialties, if we have a patient that has, rheumatoid arthritis or needs to see an endocrinologist or an OBGYN or a podiatrist, we have a lot of those specialties.
Tell me, we've only got a couple minutes left. Any final things to say that cross your mind about, just your involvement in the clinic and what it's meant to the community, and where you think maybe the future holds for the Seeger Clinic?
Well, we're always full of ideas. It's a matter of getting the funding and the time to make them happen. We're hoping this year to move into more preventative care and health screenings. We've started offering pap smears and mammograms through a state government program, and we're hoping to kind of expand our screenings and preventative care that we're doing. Telemedicine is new for us, but it was kind of forced on us with the coronavirus, but it's really been enormously helpful and well received by our patients and our providers. So that's something we'll continue to explore. So we're always, have new projects and new ideas that we try and see if we can get started and then maintain with our volunteer population. But it's exciting. It's a great effort to be part of, and it's really rewarding to make a difference in a way that seems to really matter for people. Especially patients just coming out of jail or who are trying to get back on their feet after beating an addiction. They really appreciate the non-judgmental care that we're able to give them, where we just say, hey, we have a doctor who can see you, we can get you your medicines and kind of get you on your way. And people appreciate that. Everyone needs that sometimes in their lives.
Absolutely. Thank you, Chelsea. Ruth, any final thoughts from you?
Only that to reiterate what Chelsea said, patients are so grateful for the care. They don't have anywhere else to receive it often. Even when we're delivering medicine back to the rescue mission parking lot, they are so grateful to receive it. We hand out homemade masks and we hand out medicine, and thank us profusely for that.
Excellent. Well, I think that concludes our podcast today. We have run out of time, but that was, I think, excellent information. I think I never knew Floyd Seeger myself, but of course I've heard a lot about him, and I would think he would be very happy to know where this has gone when he started this clinic. What, 30 years ago? Is it over 30 years? 32 years
this year.
So 32 years, and it's been a staple in the community, and hopefully it will be a staple in the community for years to come for those who, are homeless, or those who have a need temporarily, because of lost insurance or circumstances of their life. It really is the ultimate kind of safety net resource for those with medical needs in the community that don't have other options. So thank you both for joining us today.
You're welcome.
Yeah, thanks.
I'd like to thank Teresa and Colton as well for help putting this on, and the Ogden Surgical-Medical Society for allowing us to do this. The producers of this podcast are Clark Madsen, MD, Teresa Puskedra, and the board of the Ogden Surgical-Medical Society. The executive director is Teresa Puskedra. The host for this podcast today is myself, Mark Johnson. Editing and sound design is done by Colton Gomez. And this podcast and online CME is supported by members of the Ogden Surgical-Medical Society. Thank you.